We're here to create a healthcare system that's worthy of our family and friends and sustainably affordable. And all of us share, as a human condition, the need to access the system at some point. And so having a standard by which your loved ones at their time of greatest need are getting treated the way you'd want them to be treated, the way you'd expect them to be treated, is a standard we shoot for every day. Blue Shield of California was started during the Depression at a time when people were having great difficulty accessing health care without facing personal bankruptcy. And so the notion of having a prepaid health plan that would allow people to access health care without facing that financial hardship was incredibly important and even novel at the time. And it's every bit as important today, given how expensive and challenging the healthcare system is. So the problem is that healthcare isn't like any other industry. In just about any other industry, you can access your personal information the way you want to with your favorite mobile device. In healthcare, you simply don't have access to that information because it's fragmented, and you often don't have access to it in a digital form. But that's core to actually getting the right kind of healthcare. Knowing exactly what your condition is, what your latest test results are, is critical to getting the right treatment at the right time. So I'm really looking forward to bringing healthcare into the digital age. I tend to use more technology today driving from one city to another than would be used to diagnose or provide treatment to me should I actually fall ill. The human body is so complex and there's so much discovery that's going on every day that it begs for the smart use of technology to truly achieve the mission of high quality, affordable healthcare. I think the area of cancer research is probably the best example of the potential power of the use of data and technology. Because in that situation, it's critical to know exactly what's going on with your body at the molecular level. Where is this mutation happening cellularly for you? And it's also important to know what's out there in the world. What discoveries have come up this week, last month, that could potentially be applicable to you in your particular situation. And both of those require huge amounts of data, vast amounts of insight in sifting through data, and being able to marry those two, that's when the magic happens. So what we're doing is creating a health information exchange for all Californians, all health plans, hospitals, physicians, such that every single Californian can have a real-time digital record that's available to them on their favorite device. So far, we have more than 16 million patient records, which represents more than 40% of the California population. We have 5 health plans, over 150 hospitals and physician groups, and over 10,000 individual physicians that are participating. So we're off to a good start. After I graduated college, I had this interview, and the question that was asked of me is, what's the world's fight? And I've been asking myself that question ever since. And I finally landed on the fact that transforming a dysfunctional system, making it truly high quality and affordable for everybody, is the world's fight. It's something I'm incredibly passionate about. I love getting up every day and trying to solve that problem. And for me, it's the world's fight.